Hi everyone, I'm Quervain here with nurse practitioner Martina and Dr. Meng, ultrasound doctor, with my little daughter Evie, who caused me to have this problem with my thumb where it's really hard to open it. It's called the Quervain tenosynovitis, or mother's thumb, because of holding this little girl as she gets bigger and bigger. My thumb just progressively, the tendon got inflamed that was like straining to hold this little girl. So I'm gonna try to treat it and resolve it, obviously without surgery, using placental tissue matrix to help to, tell me how it's gonna work, Dr. Meng.
Basically to mitigate and modulate inflammation.
Yeah, so reduce inflammation, and then if there's any little micro tear from the strain of that tendon, this will help to restabilize that tendon. And you can show what it looks like here on the image, so we can show everybody what we're actually talking about.
That one,
Those two.
abductor, that one,
It's a short
and
extensor,
this
long
one,
abductor.
extensor plicis brevis, and extensor pollicis longus.
Here, these two right next to each other? Yeah, that one and that one, yeah.
Abductor pollicis longus and extensor pollicis brevis.
Yeah, so it's been really, really helpful to do the shockwave therapy on this so far, but then when I go back to hold Evie, it flares up again. And right now it's been difficult to, attach my bra at the back because I can't pull that thumb back to close. It's also hard to pull my pants up, and it's hard to lift her up, so I've been using my 4 fingers to lift Evie up from the ground. So hopefully this will make a big difference. What was done before ultrasound injections for this treatment, for this
It was
problem? Blind. Of steroids?
Yeah, steroids.
Okay.
So if you look here, there's 2 tendons, there's 2 circles right here. This is our radius. These 2 tendons share a common synovial sheath. As I track down the arm, we're going to see those 2 tendons in a common synovial sheath, and as I go further, you're going to see increased darkening around those 2 tendons. That increased darkening is inflammation. Where those 2 tendons track over each other. And you've got a little tendon split right there, so actually there might be a little tiny tear right there in the adductor pollicis longus right here. So that's going to be an excellent target site. One other consideration now, because we're talking about a new mother here, which we didn't do last time, is we're going to examine the radial nerve here. So coming back up to the elbow. This here is the radial nerve. The radial comes. Hey, thanks, Evie. The radial nerve comes down. Oh, you got it.
She got it. She wants to show you.
So as Evie pulls it away, we see the radial nerve start to split right here, and hand it back.
She needs to try it, like eat it. That's how it works.
So as the radial nerve splits, it goes to a different muscle group. So it's going to split, and our superficial branch of our radial nerve actually goes right through the supinator muscle right here. So the supinator, so as Carol rotates her arm back and forth, you can see the supinator muscle pulling her radius. So we're actually checking to see if that causes any reproduction of symptoms. And it's going through right there, or enlargement of that nerve. So in our long axis plane, here's our superficial radial nerve. Here's just the radial nerve slightly deflect under the supinator. So if I press right here, we're going to activate that. Resist me?
Oh, resist you?
Resist me. Okay, then just the other direction. How's that feel?
Feels like a good massage.
Okay.
Yeah. But I definitely feel like it's weak at my wrist. But I mean, it felt good when Devin was massaging it the last time. I don't know if that's.
It looks like it's slightly different.
Yeah, you could definitely hydrodissect it. Yeah, Bonnie was explaining to me, is this my injector hand, and that's why I overuse it. I said, no, I actually really don't use my right hand very often. So as soon as my baby was born, I started to use it to hold her all the time, and I'm flexing this tendon because the muscles were so weak and not used to working. So I think that's why the tendon got overused and torn in this one. even though I held her a little bit with this hand, I was usually holding her here and doing all my computer work with my left hand. So I think that's why the right one became so vulnerable. And now we're getting it better.
These are our two tendons stacked on top of each other. There's the sheath of the tendon. Where this is the skin, right above the tendon lines. We're going to basically be subcutaneous right here.
Cool.
So it's seriously
Tiny.
half a centimeter. So you're going to be almost parallel.
She has to. You caused this, so you're gonna allow us to fix it.
Yeah, there's the split. There's the two superficial and deep right there.
That's so cool.
Split. And you see that little fascia down here? That's a branch of the superficial right down here.
You want to
Nice.
this
Yep. So if you do that one, you get it nice and floaty. You can come down to this fascia.
There.
Not that one, deeper one.
Yeah. I want that one too, or don't leave Anna behind. Just kidding.
Yeah, that feels great.
It was pinching a little bit.
Maybe it was causing a little weakness.
It would be a little too far in the muscle.
Oh,
Yeah. Yeah.
So
There you go.
for the video, that's the radial nerve. The black was all the fluid, and the nerve is now free to move and function, and maybe it's easier now. If you want to test it,
Okay, resist.
resist this way.
That's stronger.
Oh yeah,
And
then this way?
Yeah.
oh yeah, much stronger.
A lot stronger.
This one was the one that I noticed most, but both were stronger.
Much
Cool.
stronger.